Hello everyone. We are studying Neuro Radiology. In that, we completed three topics. First topic related to hemorrhage, different types of hemorrhage, and second is related to accidents, trauma, fractures, etc., etc. Third is related to neuro tumors. So today we will discuss the fourth topic, that is stroke. Very, very important. So we will discuss complete details about stroke in detail. What is meant by stroke? Stroke is nothing but the onset sudden onset, okay, which leads to mostly damage to the part of the brain. Okay, sudden onset which leads to damage of, or we call irreversible damage, sometimes irreversible damage of neurological deficit or deficit. Okay, sudden onset of irreversible neurological deficit. So this is nothing but stroke. So in that, what happening that in the brain parenchyma, something is happen. Due to that reason, the brain, in that brain, neurological disorders happen. So okay. So stroke is mostly diagnosed by clinically. It is very much, it is diagnosed by clinical. This is one important thing we have to remember about stroke. Okay, so let's discuss of the causes. So we have different causes, two types of causes. One is, if any neuron had damage, we have two reasons: either blood supply stopped to the brain, either any bleed happened, any damage of nerve, damage of artery, damage of vein. This happened, any one of these three. So it may be damage, means here hemorrhage. Damage means venous hemorrhage or the arterial hemorrhage. We discuss in SCAH, SDH, everything, but here also we'll discuss. So blood supply is decreased or restricted, suddenly restricted to the certain part of the brain. We will call this is ischemic stroke. We will call ischemic stroke. If damage had happened, due to that, the hemorrhage, bleeding will happen. So there's the reason in the brain, the certain area of the brain is stopped or compression, anything happened. Okay, so we'll call hemorrhagic stroke here. Hemorrhagic stroke. So in the most of the cases, the patients are more in ischemic stroke, 85%. In the hemorrhagic, 10% cases. So other 5% we have other cases. But most of the persons are suffer with ischemic stroke, blockage of arterial supply to the certain part of the brain. Okay. In the hemorrhagic stroke, what is the cause? That is mostly underlying disease, that is hypertension. Due to the raised blood pressure, so the artery blast happened. So the blood supply, blood is exist from that artery to the outside area. Okay. But ischemic stroke, the reasons are multiple. We'll discuss here. In that we have, one is large artery atherosclerosis. So any blood supply to the brain is stopped due to the any plaque formation or fatty material substances is formed there. So that creates blockage and that stop the blood to reaching to the particular area which requires the blood. So it is one reason. Another reason is embolism. The reason of ischemic stroke is embolism. Means atherosclerosis is happened within the heart arteries. Okay, we have coronary arteries to the brain. So there's the reason. So the clot is not stopped here. It went to the into the blood circulation and it enter into the brain area. So which cause embolism means stoppage of blood flow to the per certain area. So embolism, it is the clot is coming from cardiac region, heart region. And another one is small vessel ischemic disease. Small vessel disease means their blockage is happened, means the damage of arteries are happened, but the damage amount of arteries are lesser than 10 mm, lesser than 10 mm, sorry, lesser than 10 mm. So also we will call small vessel disease in most of the MRI reports. You can see that small vessel ischemic disease. Okay, and another term utilized here, that is lacunar disease, lacunar stroke, lacunar stroke. So small vessel disease, also known as lacunar stroke, means the blockage of arteries or not that much amount, but slowly the plague is occupying the vessels. Okay, it is going to block the arteries. Okay, small vessels. Okay, so it means that this is small ischemic disease. Okay, so these are the reasons. Mostly the blockages happen due to the fat extension, fat excess fat in the body. Okay, so next I am going to on picture, that is, so whenever a patient had any type of stroke, it may be hemorrhagic, it may be uh, we have another ischemic. We'll have to see these six symptoms. That is first, that is known as be fast. Be fast. You have to act very fastly. So there's the reason we have a mimic, that is be fast. From B we have balance. The patient had any sudden imbalance of walking or suddenly unconsciousness or dizziness suddenly, and it is continue happening. Okay, this is for balance. E for eye, sudden loss of vision, any changes in vision, one eye or both eye gradually happen. So it doesn't mean it is a neurological or it is a optic problem. Both can be happen, but sudden onset happen. So it is mostly due to the neurological deficit. First, if from face means half of the face is paralyzed, numbness, drooping like this, or you have saliva, unable to close the eyes. Okay. A for arm, sudden loss, weakness of arms or limbs. Anything happen, weakness, numbness, unable to lift the hand or move the hand or unable to walk, anything can happen. Next we have S. From the S, you are unable to speak or slurred speech, speaking difficulty. Anything will happen. Okay. Next from T, headache, terrible headache, or time. T from headache or time. Okay. Some had given here's headache, or some had taken from T to time. So you have any, you have to act fast. Okay. If you want to reverse the damage or stop the damage for a certain extent. Okay, so you have to call the hospital or ambulance. Okay, so according to that, the doctor will treat. Okay, so here you have the time. So how can identify the timeline? And let's discuss that. We have this disease can be divided into four stages. We have to write CVA, ischemic stroke here. If it is ischemic, or only CVA is also enough. CVA, hemorrhagic stroke, CVA, ischemic stroke, or CVA with any symptom like facial paralysis, left side weakness, right side weakness, or balancing weakness, anything you can write. Okay, so how you have four, this disease becomes in four stages according to time. Time is very important. Be fast. Last one is time. So if it is this first stage is hyperacute, hyperacute. Second one is acute. Okay, and third one is subacute. Okay, and fourth one is chronic. Hyperacute means it is first 6 to 8 hours. First to 6 hours are called golden hours and treatable. Patient had very highly chances the damage will be reversible, or we can stop certain existence of the disease. Okay, acute means less than 24 hours. Okay, less than 24 hours. Subacute means 24 hours to 1 month. Okay, 24 hours to 1 month. Chronic, more than 1 month. So, in which state the patient is coming, it is very important. So, mostly in the hospitals, the patient will arrive within 1 24 hours or within 6 to 8 hours if they starts seeing the symptoms. So, it is very, very important to us. So, it is be fast. Be fast is very important thing which we have to remember. B for balancing, E for eyes, F for face, A for arm, S for speech, T for headache or time. Time according to the time I discussed here, 6 to 8 hours, hyperacute, acute below 24 hours, subacute 24 to hours to 1 month, above 1 month that is chronic. Okay. So this is the important thing we have to remember. Next is important thing we have to remember about stroke is the circulation, because here circulation is very important. So which part of the brain are getting which arterial supply? So if the damaged artery or clot happened on that artery will result to get you the symptoms. Okay. This is very important. So let's see the arterial supply to the brain. You can see this is the circle of Willis, the whole circulation to the brain. Like this, you can see if you see from the on the bone in the brain posteriorly. Okay, you can see this is the anterior cerebral artery, the artery which supply front portion. Mid cerebral artery, you can see this is the mid cerebral artery. This is the internal carotid artery. This is coming from that carotid artery. Posterior cerebral artery. This is the posterior artery, cerebral artery. You can see that. Superior front above, okay. Pontine arteries, if they are blocked, pontine problems will occur. Okay. If anterior cerebral artery and cerebellum is here. Okay. Can see that here. Posterior inferior cerebellar artery. So all these arteries are very important. We will call large arteries. We have to that. These are the large arteries. So like let's see the image one more time. This is the best thing you can remember that. This is this front part, anterior artery, cerebellar artery. This is anterior cerebellar artery. Side is mid cerebellar artery. This is also mid cerebellar artery. This is choroid artery. Okay. This is choroid artery. And this is posterior cerebellar artery. This is also posterior cerebellar artery. Okay. This is mid cerebellar. This is mid cerebellar. This is mid cerebellar. This is carotid artery, posterior artery, posterior artery. So if the problem occurs in the particular region of the arteries, so that person will have the symptoms. So let's see the symptoms according to that area. So if a patient have posterior cerebellar artery, backside, so he have first two things. He have imbalance and eyes problems. This is very important. If a patient have cerebellar artery, balancing will affect. Okay, balancing will affect. Okay. If the patient have mid cerebellar artery, you can see that this is the mid cerebellar artery. Posterior artery, okay, mid cerebellar artery. What are the symptoms mostly? You can see that is facial problem. Okay, and you have weakness and sometimes speech difficulty. So B is based on cerebellar posterior artery problem. FAS is mostly medial and anterior cerebellar artery. So that's you can with the help of this symptoms you can easily identify the area of the brain, which part of the brain is affected. Okay, so this is all about in today's class. So we discussed numerous thing about cerebellar artery, sorry, about stroke, how many types of strokes are there, what are the symptoms, what is the time, be fast. Okay, all this we discussed. So, and the classification of strokes, hyperacute, acute, subacute, and chronic. And we discussed about 8 arterial territories. So this is arterial territories, the area which supply the artery. Okay. So we have different arteries. You can also see this in this image also. So this image is very, very important. So, okay. So this is all about. So tomorrow we'll discuss about how the stroke is identified, means how to manage protocol, how to identify that is also. Okay. And different MRI, CT, what to be done and how to calculate everything we will discuss tomorrow, and what are the important scans to be done when the patient have the arrived in your clinic at what time, acute, what you have to do, subacute, not in your clinic, in your hospital. Mostly this is treated in the hospital part only. Okay. In the acute, subacute condition, chronic or subacute condition. Okay. So we have the symptoms also. According to that, we will discuss. Okay. So tomorrow we will discuss detailing of that things.